Welcome to Psoriasis on YouTube channel. We cover all things psoriasis on this channel. What is CBD and can it help with psoriasis? Cannabis is a plant that contains over 80 physiologically active chemical compounds called cannabinoids. Cannabinoids have a variety of biological actions in the body, including anti-inflammatory, antioxidant, and psychological impacts. Despite the availability of numerous effective topical and systemic psoriasis treatments, many patients still experience chronic itching and suffering. They also have to deal with the stigma and psychosocial effects of having a visible skin disorder. It's hardly surprising, however, that individuals suffering with this condition have turned to a range of alternative therapy choices, including cannabis-based medicines like CBD. In terms of the potential advantages and hazards of cannabis-derived drugs, the medical community has only scratched the surface. CBD's biochemical effects on the human body must be carefully considered. Many factors influence their effects, including the mode of delivery to the body, topical application, inhalation, or oral intake, the cannabinoid dose or concentration, and the exact chemicals extracted from a particular plant strain. However, it's a safe assumption that cannabis' potential psychological, e.g., anxiety reduction, and anti-inflammatory benefits could assist relieve the disease burden associated with psoriatic disease. How do cannabinoids like CBD affect the body? THC is another typical cannabinoid isolated from the cannabis plant, similar to CBD. CBD and THC, on the other hand, have separate characteristics and have quite different impacts on the human body. THC and CBD interact with receptors in specific tissues or the neurological system to mediate a wide range of physiological effects, including reduced inflammation, itching, and pain reduction, greater capacity to sleep, hunger stimulation, and decreased anxiety. Cannabis-derived medicines may help psoriasis sufferers with specific concerns like discomfort, itching, or difficulty sleeping minimize the negative impact these symptoms have on their lives. Medical study is still going on to figure out how cannabinoids like CBD and THC affect health and modify biological systems including the immune response. CBD and other cannabis-derived drugs have not been thoroughly investigated in people with psoriasis and other inflammatory skin conditions. This is a gap in the market that has to be filled. CBD appears to retain many of THC's biological effects while avoiding the high that most people associate with THC and marijuana. This important distinction has prompted a number of companies and research organizations to investigate and produce pure CBD products that may be more appealing to patients who want to avoid or cannot handle the euphoric effects of THC-based products. CBD has been a popular choice among consumers who are new to or inexperienced with cannabis-based products as a result of this distinction. Are CBD products suitable for those with psoriasis? What are the potential dangers of CBD products? CBD and other cannabis-derived drugs have not been thoroughly investigated in people with psoriasis and other inflammatory skin conditions. This is an unmet need that merits continued research and attention. Prior clinical trials, however, are instructive and suggest that potential concerns should be evaluated, particularly in psoriatic disease patients. Several studies have associated systemic CBD and other cannabis-derived products with worsening heart disease, obesity and diabetes, fatty liver disease, or a higher likelihood of surgery to treat inflammatory bowel disease. Psoriasis patients need to be aware of the psoriasis-associated diseases and their potential worsening with cannabis products. Adverse events are also more likely with systemic or high-dose intake, compared to other delivery methods such as topical CBD oil, for example. What should patients with psoriasis do if they are considering CBD? It is critical to conduct research. To better navigate the cannabis landscape, patients contemplating holistic or alternative forms of medical therapies for their chronic medical issues should have open discussions with their healthcare physician. Before using CBD, it's also a good idea to look for products with clear ingredient lists and a strong brand reputation. We encourage that psoriasis patients seek assistance from established medical organizations and patient advocacy groups until we have more extensive, thorough research about the potential effects cannabis products have on human physiology. The National Psoriasis Foundation, NPF, is actively working on psoriasis guidelines for cannabis use in psoriatic disease patients. Thank you for watching. Please, like, comment and subscribe for more psoriasis information. Keep your feet on the ground and keep reaching for the stars.